Welcome everyone. Thank you for joining us today. I'm Mrna, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 9 new cases of COVID-19 in Windsor and Essex County. 3 are close contacts of confirmed cases and 6 are community acquired. We have had 16,751 cases since the beginning of the pandemic. 89 people are active at this time, with 28 of our active cases being a variant of concern. To date, 1,919 preliminary or confirmed variants have been identified in Windsor-Essex County. 10 people are currently in the hospital and 3 people are in ICU. Our community has lost 433 people to COVID. There are currently 5 active outbreaks in Windsor and Essex County, 3 workplaces and 2 community outbreaks. Regarding our vaccine report, 354,949 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 266,287 people have received at least 1 dose. Overall, 72.8% of adults 18 years of age and older in Windsor-Essex have received at least 1 dose of a COVID vaccine, and 25.5% of our adults 18 years of age and older are fully vaccinated with 2 doses. Residents of Windsor-Essex County 12 years and older are able to book their vaccine appointment for a first dose at one of our mass vaccination sites. Seniors 70 years of age and older are able to book their second dose appointment. In addition, those who received their first dose of vaccine up until and including April 18th are able to book their second dose at one of our mass vaccination clinics. There are also new changes to the AstraZeneca intervals, so people booking an appointment on our booking system will be able to book their second dose 8 weeks from their first dose. Please read the information posted on our website about this change. To book an appointment at a mass vaccination site, please visit wevax.ca or call 226-773-2200. In addition, those who have received their first dose of a COVID vaccine out of the province or the country and would now like to book their second dose in Windsor-Essex, we ask that you please call us to register your first dose information in the COVAX system. You can do that by calling our health unit's immunization hotline at 519-258-2146, and the extension is 1222. You will be asked about proof of vaccination, and we will record your first dose and direct you on how to book your second dose. In follow-up to a question we received on Monday, I wanted to provide this update on the past weekend and the work of our inspectors and enforcement officers. So over the 2 days, last Friday and Saturday, our enforcement officers inspected 21 premises, including bars, restaurants, and retail. They focused on education on the new regulations, and the most common infractions were related to physical distancing, patio occupancy signage, screening, face coverings, loud music on patios, and people consuming food or beverages indoors. A total of 4 charges were issued for indoor dining and face covering non-compliance. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. Today I want to talk about vaccine interchangeability again. Vaccine interchangeability is not a new concept, and it's generally acceptable if there are certain conditions that allows people to use the vaccine from different brands or different companies, as long as these vaccines are authorized for the same indications and with equally acceptable schedule, or if it's authorized, and it should be authorized for the same population group, and it contains comparable type and quantity of antigen, and it has to be similar in terms of safety, reactogenicity, immunogenicity, and efficacy. So anytime when we are talking about the vaccine interchangeability, all of these conditions have to be met. When we are talking about the COVID-19 vaccine, all of these conditions has to be met and has been meeting. There are recommendations that already exist for vaccine interchangeability, not for just for COVID vaccine, but for all the other vaccine that many of you are familiar with. For example, diphtheria, tetanus, pertussis, and poliomyelitis, and the hip vaccine, hepatitis A vaccine, hepatitis B vaccine, human papillomavirus vaccine, influenza vaccine, MMR vaccine, pneumococcal conjugate vaccine, rabies vaccine, typhoid vaccine, varicella cantining vaccine. So as you can hear, that these are all the vaccine that there are specific guidelines already exist for interchangeability of this vaccine. This is not the new thing that we are doing. This is not based on something that is being driven out of any other reasons except for following the science. And if the scientific criteria is met, those conditions are met, and then vaccine interchangeability is allowed. When it comes to COVID-19 vaccine, we get it. There's a lot of interest, and there is a lot of concern about the safety and effectiveness of these vaccines. And we have always been very open in sharing what the scientific data suggest. And we can see the response in Canada, how effective these vaccines have been in containing the spread of COVID-19, how quickly we have turned around the corner, and now suddenly Canada is the leading country in the world with at least one dose of COVID-19 vaccine. And did we compromise on the safety and effectiveness of this vaccine? Not at all. What we are seeing is all of these vaccines that have been given out in Canada, it resulted in better protection. It resulted in generating a better immune response. And we have seen that data coming out from some of the other countries as well, that the increasing the interval of these vaccine didn't cause any concerns from a safety or effectiveness perspective. So as we continue to learn more and more about these vaccines, we continue to share information, we continue to give more data to the public to make an informed decision based on the scientific data. At this time, it is absolutely important that we should stick to the science and we should stick to the scientific facts rather than thinking about any kind of policy directions or any kind of decision that is not based on science. When it comes to COVID-19 vaccine safety and the immunogenicity, obviously it is my concern and it is everyone's concern. We want to make sure that if there is any vaccine interchangeability happening, it is happening in a safe manner, which we already have the data from at least 3 different countries, UK, Spain, Germany, and also in Quebec, where the vaccine interchangeability has been studied and it has been offered to people to assess the effect and impact of these vaccines. And all of these countries' data points to the fact that other than the mild vaxia flu-like symptom that a lot of the people experience, it experiences the same. But other than that, there is no concern from a safety perspective of these vaccine interchangeability. There is no concerns from an immunogenicity perspective. And again, so for people who don't necessarily understand the immunogenicity concept, and I tried to explain that last time as well, what vaccine is doing is vaccine is basically helping the body identify what the virus looks like. And it can be presented into the body in so many different ways for body to recognize. When we're talking about the mRNA vaccine, what it's doing, it's using an mRNA-based protein that triggers the body to create a spike protein that is the identifying factor for the virus. And when the body recognizes that this is the viral spike protein looks like, it creates a defense mechanism or immune response against that. And that's how the body fights against that virus. So the next time, if the body is seeing another spike protein with a virus with a spike protein, it creates that same kind of response and contain the virus before it leads to any disease or cause more severe complication in the person. Any other type of mRNA vaccine, it will generate exactly the same response because it's using exactly the same type of same mRNA, and the body will generate the immune response similar to that. So there is no concerns from a safety or immunogenicity perspective for both these vaccines, whether we're talking about the Pfizer or the mRNA vaccine. Even when we are talking about, let's say, a viral vector protein, how does that impact? A good example can be if you have a virus that you're looking at, so you're presenting it with the spike protein that the body is recognizing that spike protein in the form of an mRNA, mRNA fragments, which is causing the body to create that the spike protein. If you're introducing a viral vector protein, what it does, in the viral vector protein, it creates a component of the virus directly with the spike protein. And then when it's presented into the body recognizes it in the same way. So the mechanism may be slightly different in terms of how the spike protein is introduced or generated into the body. But at the end of the day, it both recognizes that spike protein that leads to the immune response. So in some cases, it may be even better that you are seeing the virus from two different forms, one in an mRNA format, and the other one is, if you're looking at it, from a viral vector protein format. So there is no safety concerns, there is no immunogenicity concern, and this is all based on the data, scientific data that came from UK, Spain, Germany, and also Quebec is doing that. So from that perspective, we are okay. And then when we are looking at the NACI recommendation, the National Advisory Committee on Immunization recommendation, it does recommend, which is, again, it's nothing different. They haven't changed their recommendation at all. They've always said that, if for the sake of convenience, try to use the same vaccine. But we know we're living in a pandemic. We want to get out of this pandemic. And we know that we have the vaccine. When we have the vaccine, we want to make sure that it gets into the arms of the people. And we can quickly get the immune response that we need. We don't want our community to continue to see ongoing cases, ongoing transmission in the community. We don't want people to die. We don't want people to get hospitalized. Those are the bigger issues that we are seeing. And it's not based on any policy direction. I will tell you myself if it's a policy direction versus if it's a scientific recommendation. The scientific recommendation or NACI recommendation, it has nothing to do with whether it's out of convenience. This is based on the scientific data. And if I don't feel comfortable, I wouldn't be recommending that. And even NACI, it's their strong recommendation that if you have the vaccine, the first vaccine, and we have always said that the first vaccine that you have access to, get it, to get the protection. So hoping that this would help to clarify any concerns in the public and help them make a good choice. At the end of the day, the choice is always yours. There is no force. There is nothing that we are saying that you must, but we are limited by the number of vaccines that are available to us, and we'll continue to do that. But I just want to be very clear that in terms of the safety and effectiveness of the mRNA vaccine, there is no difference. There's barely a difference that you would ever even notice, like 95% to 96% effectiveness, which really doesn't matter at the end of the day in the grand scheme of things. Other than that, both these vaccines are equally safe and equally effective in preventing COVID-19 disease. Thank you.
We'll now take questions from the media. Today we'll start with CTV.
Good morning. Do you think with the CDC not approving AstraZeneca or mixing of the mRNA doses hurts the goal and feeds into the vaccine hesitancy?
Well, respectfully, we do follow a lot of the recommendations from CDC, but I think there are many recommendations that I would like to see that where's the evidence for that and what is the rationale for that. In Canada, we do have a good scientific body and we have followed the science all along. We can see the difference, and again, it's no, complaint against CDC, but if I want to look at what their recommendations and how effective those recommendations were, Canada, we did an excellent job in terms of dealing with the pandemic. Look at what we have achieved, what we have accomplished, how many lives we have saved based on our recommendations and based on our vaccine rollout. So yes, it does create some confusion, but I want to tell people that your country, Canada, and the guidance that it's coming out from here, those are all based on scientific data, which is already evident. Look at our cases, look at what we have done in terms of the vaccine. And I quoted in the beginning of my talk as well, that increasing the interval, did it lead to any issues? Not at all. CDC recommendation is to stick to the 21 and 28 days. It's different, and it may make people think that maybe that's the better option, but looking at our better situation, what worked for our country, what has worked, and if there has been any concern. AstraZeneca, they never approved, but CDC never approved AstraZeneca, but they did approve Janssen, which is a similar vaccine. So it's not about the vaccine issue. There may be some other issues that they were considering. AstraZeneca was used by UK. For the majority, 80% of their people were vaccinated using AstraZeneca. And look at where they are in terms of the coverage and in terms of their protection. They're pretty much open right now based on their coverage rate and everything. So every country make these decisions based on their local situation, based on their understanding and interpretation of the data. But that doesn't mean that that's the holy grail that we all have to stick to, even though there are many differences in the two countries. So I want to support our Public Health Agency of Canada recommendation, NACI recommendation, and all the recommendation that we have been doing. And the result is evident. Canada has done an excellent job in containing the pandemic. In the vaccine rollout, we are now the #1 country with the vaccine coverage rate at this time. We started slow, yes, but look at where we are. So I would 100% support our position, and I think people should know that where we stand in terms of our recommendations and how effective our recommendations have been so far throughout this pandemic.
Okay. And do you think a 2-dose summer is possible for Windsor-Essex?
Absolutely, and we are trying our best to do that with the vaccine rollout, with the news of more and more vaccine coming in. We are ramping it up. We are seeing an increase in the vaccine rollout through all the channels, pharmacy, primary care providers, and through our mass vaccination clinic. I think we are in a better position to do that. We definitely want to provide the vaccine to everyone in our community as soon as possible, and that's why I'm touching on this topic of vaccine interchangeability to make sure that people have the right information and they're not looking or hearing information that is inaccurate.
And did the health unit provide guidance to doctors and clinics providing pop-up or walk-in clinics regarding the second dose eligibility?
Well, all the information that we receive and we create, we share that with all our health system partners, including our primary care providers and the pharmacies. They also receive some information, pharmacies especially, they also receive some information directly from the ministry. But our healthcare partners, primary care providers, they get all the information from us, as well as they have access to all the right information as well. They're also professional. You have to understand that they're also, when we're talking about the primary care provider, they are doctors, and they have access to all the information. We obviously share our expertise as an expert. I am always available to them, and we continue to share information, most up-to-date information as soon as it becomes available to us. We share it with all our primary care providers as well.
Has the health unit needed to take any action against clinics inappropriately providing second doses?
Well, I think if you're referring to maybe some shortening or maybe people not sticking to the schedule, there has been some concern that we become aware of, and we've had some conversation directly with these clinics and the pharmacies to address those issues. And after talking to them, those issues were resolved, but recognizing that there are many primary care providers, there are many pharmacies, and it may not be easy to address all these ongoing issues on a regular basis.
Okay, switching gears to reopening now, Kingsville Council is asking Doug Ford to visit the region, I guess, to see the impact of the extended closures. Do you think the pace of reopening is too slow, considering the high vaccination rate and low case count in the region?
Well, I think our region has been lucky in terms of avoiding the third wave. As Teresa reported every day, and we report that every day, our vaccination coverage rate is really high. We have our adult population, almost 73% of us are vaccinated with at least 1 dose, and more than 25% of us are vaccinated with 2 doses. In the step 2 of the reopening plan, we do talk about at least 20% of the people vaccinated with 2 doses. So we have already crossed that mark, and crossed that significantly, 25% or more than 25%. So we are in a better position to maybe consider reopening. But I always caution in terms of the active cases. I think as a community, we are in a position that we can open up, but we recognize that this is something that's happening provincially. But I think we are in a position that we can open up sooner than later.
Okay, thank you.
Any questions from CFTV?
Yes, good morning, Dr. Ahmed. I have a question regarding immunity. When you were talking, we're all going to get our shots, and that's wonderful. And what's the immunity like? You're talking about immune response. So the immune response to some of these variants that we have. The Delta variant is pretty nasty, and I was wondering, once you have your shot, what's your immunity rate? How well is your immunity going to be against something like that coming in?
So a great question. So the immune response, that's the basic principle of getting the vaccine. And even with the variants, these vaccines are fairly effective. And even with the new data that just came out from UK with much bigger sample size, even for Delta variant, I know the initial data suggests that the Delta variant, the immune response may not be as great and effective. But with the newer data, with the larger sample size, these immune response or the vaccine effectiveness is calculated to be more than 90% for the mRNA vaccine, for the Pfizer vaccine and the Mrna vaccine, and close to 84%, if I remember correctly, for AstraZeneca if people were vaccinated with 2 doses. So right now, I think what we are looking at is, yes, people are protected with the 1 dose of vaccine for the most part. 73%, almost 73% of our adult population are protected. We want to increase it to the second doses as quickly as possible. So we already have more than 25% of the people protected with second doses. So we've got a good coverage rate of vaccination with full 2 doses of vaccine, and we want to increase it. And so from an immune response perspective, both these vaccines that are available that we are using here, right now we are not using the first dose of AstraZeneca, but even for those who are fully protected with AstraZeneca, they are more than 80% protected with the Delta variant, which is a significant concern in some of the countries. But I think the more and more people get their 2 doses of vaccine, we'll be in a much better spot. We won't have to get concerned about these variants and these vaccines. The message right now is, get your second doses, and if you haven't get your first dose, which I think there are very few people, please get your first dose and second dose as quickly as possible, so we as a community can move forward. We as a community can open up. We as a community can continue to stay open instead of opening and then closing down again.
Thank you very much.
Any questions from CBC?
Yes, good morning. Dr. Ahmed, you mentioned that we're in a position to reopen sooner than later. Are you actively advocating for this to the province? Or do you plan to do so, once we start seeing the impact of the move to step 1 on cases?
Well, I think one of the things that I'm constantly looking at, it's our daily cases and how we are faring. So I think even from last week to this week, I think we are moving in a better direction with the case rates consistently coming into a position which makes me feel much more comfortable every day. I haven't started that effort yet in terms of actively advocating, because obviously there's a risk in one or the other, but I do feel about our economy, I do feel about our people, I do feel about our small businesses and how everyone was impacted by the COVID-19. So I want them to open up, and I want them to open it up safely. So having said that, these decisions, these conversations happen at the provincial level, haven't happened yet with us, but we'll be supportive of that if and when the province decides, or if they ask for our opinion. We'll definitely be supportive of that if the trend continues in the right direction.
Thank you. And with regards to the mixing of vaccine products and the goal to get the population fully vaccinated sooner, I was just wondering, to be totally clear, are you offering Mrna at max vaccination clinics for second doses right now for people who got Pfizer at first, or are there plans to actively implement the mixing and matching of second doses, given we're getting that increase in the Mrna supply this month?
So the answer to both the question is yes and yes. So even right now, some of the clinics or the primary care providers or the pharmacies, they do have a supply of Mrna, and people can choose to get it if they're not getting their first dose of Mrna. So they can still get their second dose of Mrna through these pharmacy channels if they've received Pfizer in the past or vice versa. So they do have that option. From the mass vaccination clinic perspective, I think we haven't got to the stage where we are actively keeping enough of Mrna to allow people to switch at that time. Anticipating that the supply will increase next week and then the week after, we will be in a position to run the clinic with one or the other vaccine, and then people will be aware, and they should feel comfortable. I think that's the key message, that they should feel comfortable that regardless of whether you're getting your second dose of the same mRNA or a different mRNA, these vaccines are equally safe and effective. So I think that's the bottom line. If and when we switch it all in the mass vaccination clinic next week, people should feel comfortable, people should feel confident that we're not compromising on the safety and effectiveness of these vaccines.
So please correct me if I'm wrong, but I believe, Teresa, you said on Monday that we're getting 17,000 doses of Mrna this week. Is that sort of the kind of supply that we'll be getting for the rest of the month as well?
So we believe that'll be the start. We know that provincially we will be getting a lot of Mrna, so it'll probably be more coming to our area. But you're correct, this week, which will be toward the end of the week, there's a lot of Mrna coming to our area that will be across all of the channels that distribute vaccines. So public health units, as you know, we're vaccinating along with Windsor Regional Hospital at the mass vaccination sites. Primary care and pharmacies will all be getting Mrna as well.
Thank you very much.
Any questions from Blackburn?
Yes, good morning. With the increase of supply that's expected, and I'm noticing there are, appointments available throughout the days that are posted online, has there been a discussion about expanding the eligibility, and when do you think the next expansion will happen?
So we have regular meetings with the ministry, and they are having those discussions right now. And all I can say is that we do give our input, and there's pros and cons of moving too quickly and opening it up for everyone, but those are exactly the conversations. But we generally align with the province, and will provide more opportunity to expand our eligibility when we're able to do so. So that is in discussion right now.
And maybe just talk about we've met a couple of milestones within the last couple of days. We are below 100 active cases in the region, and then we've just reached that 25% that are fully vaccinated. Can you talk a little bit about those milestones and what that should mean for the community?
Well, I think for our community, this is really a significant milestone. And as I was answering to CBC with the last question, that I do feel comfortable with respect to our reopening plans or moving to the second stage based on these numbers. Getting our active case rates to less than 100, that's really a good thing that we noticed, and we definitely want to keep it that way. That's the key message. We definitely don't want to go back to where we were before. Looking at the 25%, the second dose coverage rate, again, a huge milestone and for our community, and thanks to all our partners who made it possible. And I think we are in a much better position as a community to move forward and do the right thing. We have sacrificed many things. Our businesses have sacrificed many things. So I think now it's time for all of us to learn some of these lessons, make sure that how we can keep ourselves safe. Still, there's a lot of cases outside of Canada. Canada is in a much better position. Our case rates have gone down. Yesterday, the province reported less than 300 cases throughout the entire province, which is significant. And we are obviously in Windsor-Essex. We didn't see the same impact of third wave, so we are in a much better position. I'm really happy, and I want to make sure that we keep this way for our community. We keep our community safe. So anyone who's still waiting to get their vaccine, please get the vaccine and continue to follow some of these measures that are in place. They are there to keep everyone safe and keep everyone protected.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Doctor, your presentation about vaccine interchangeability is fairly impassioned. I'm wondering, what misinformation are you seeing out there, and what threat does it pose?
Well, there are, and unfortunately, sometimes, even accidentally, people say things. It does, excuse me, it does make things more difficult for people to understand. Most of the people, they're all interested. They're all listening to everything that we are saying, and there shouldn't be any confusion unless some things are not clear. There are some clarity to many of the recommendations, many of the actions that we suggest, and there are at times when we are in a position where we say, hey, we don't know about this, and if more information comes in, we'll share that information. That's how science evolves. So I wanted to make sure that people are not listening to some of the information from people who may or may not have the ability to understand or make any of those recommendations. And respectfully, even to my to some of my colleagues as well, we are all doctors, we are all professionals, but I wouldn't be making a recommendations on what a cardiologist should do, what should be done if someone is having a much more complex issues of heart failure or myocarditis or something like that. But public health, vaccine recommendations, vaccine rollout, those are all public health things, and this is what we do all the time. That's what our expertise is. So, and again, not targeting any of my colleagues, but just giving it as an example. Anyone who's not even a doctor, forget it. I think they shouldn't even be commenting on that. I'm just talking about some of my colleagues and their limitations in terms of their recommendations. But people outside of medical field or people who don't even know about the scientific aspects of it, I think they should not be commenting on these type of effectiveness or creating those doubts. When these doubts are implanted into people's mind, there will be hesitancy, there will be reduced uptake. We know the vaccine hesitancy is much more prevalent in US. And again, different country, different situation, different level of access to information. We have done an excellent job. Canada has been a world leader in terms of public health. And again, this is not, I'm saying based on, because I'm a public health expert, but that's the reality. Canada is way ahead in public health in the world. And our recommendations and our expertise speak to it, and we continue to say that we don't need to follow others. I think we have done an excellent job to for our country and for our people for them to see the effect. So these messages, these misinformation, it just creates those doubt in people in public's mind who may not necessarily understand all the nuances. So as an expert, as a professional, it is my job to make sure that they get a clear recommendation. There shouldn't be any doubt. And if there are things that I don't know, which I always have admitted that I don't have the answer for that, and will continue to do that. But science evolves all the time, and we'll continue to share the most up-to-date recommendation and the collective wisdom of not only myself, my entire health unit team, and also our entire public health community.
Thank you.
Any questions from AM 800?
Teresa, going back to what you said in your opening remarks in regards to this past weekend, seems like very successful. The businesses followed suit, most of them. Like you said, there was 4 charges laid. overall you're pleased with how that first week went and your team is pleased?
Yes, I think they, I think overall they were. They said there was a lot of education going on, people asking the right questions, trying to understand what's acceptable now. And so I think overall it looked pretty good. And they continue to be out there. And also they deal with the ongoing complaints as well. So yeah, they've done a great job. And I think the community's doing a great job too. They were ready for this and want to get reintroduced to some of our services very safely as well. So that's all good.
Lots discussed here so far this morning, so I have a couple follow-up questions to my colleagues' questions. I just want to make sure I have it right. So right now, if an individual, and I know you go on the website, it says what vaccine you got. So if an individual, for example, got Pfizer, they booked their second appointment at one of the mass vaccination clinics in our area, when they go to the site, they will get Pfizer, and if they got Mrna the first time, they would get Mrna. Is that safe to say?
So right now, on our booking system, and also when you go for your vaccination, we are giving if you received Pfizer, you're likely to get a Pfizer second dose. If you received Mrna, you're likely to get a Mrna second dose. This can change based on the vaccine supply. So as you know, we are going to get a lot of Mrna to our area, to the province. So at some point, it is likely that people who received Pfizer or AstraZeneca as well, that they could be getting a second dose of Mrna. So the interchangeability, we're trying to match first dose with the second dose, or the second dose with the first dose. But based on vaccine supply, we may have to interchange them, and that is completely acceptable, and that's what we plan to do. People have to be immunized with informed consent, meaning that they need to know what they're receiving, and so people will be aware of the vaccine they are getting administered. So if it's not clear on our site, they need to call, get their questions answered, and even when they show up, the responsibility of further confirmation of their consent is the vaccinator. The nurses that are vaccinating will be making sure they have all the information and are aware.
Will they know prior to going to the site to get their second dose if it's Mrna or Pfizer that's being offered? Will they know prior to going to the site?
So right now, they do because it asks you what your first dose was. So we are managing our sites. A lot of our vaccine sites, you'll see that we, you might not see, but we do have both vaccines at the sites. So it's being carefully managed that if a site is doing 500 doses a day, and 200 are Mrna and 300 are Pfizer, we are supplying both vaccines to the clinics.
And then one question for Dr. Ahmed. Dr. Ahmed, just in regards to step 2 of the reopening, I believe the earliest date we can shift to that stage is July 2nd. So is it safe to say you're saying right now, if the province announces on July 2nd that we're entering stage 2, you would feel comfortable with that?
Oh, absolutely. I think, let's say if the trend continues, if the province announce that maybe this weekend or the next weekend, we can go move to next step, I'll be comfortable with that.
Thank you.
Any questions from Radio Canada?
Yes, good morning. I have a couple of questions regarding testing. So first of all, I would like to talk about testing for people who are traveling abroad this summer. So are they free in Windsor-Essex? If not, why? Are they different from general testing?
So your question is about the asymptomatic testing for the purpose of traveling. So I think the last time I checked, it was still available and it was free for people through the assessment center. And if not, then there are pharmacies that they can access to get those tested. The whether it's available or not, I think we can circle back on that to make sure that that's the case. But last time I was aware that it was available free of charge for people who are traveling.
Okay, I'm asking just because we heard from people that they have to pay more than $200 for that testing. So I guess you know nothing about it.
Yeah, that does seem odd because even for the actual test cost is close to $40, not $200. So it just does seem odd. We can definitely check with our team that if what's the most up-to-date guidance. But to my understanding, it is available and people can get tested. But we can definitely circle back with you.
Okay, thank you very much. And my other question is about vaccine. Do you have any idea when the second dose will be available for the overall population of Windsor-Essex?
So there has been some active conversation with the ministry at this time in terms of moving to the next tranche of people who will be eligible to receive their second dose. So right now, anyone who has received the vaccine before April 19th, I believe, they are eligible to book their appointment to get their second shot. And with more and more supply coming in, we are anticipating that the eligibility criteria will be expanded. Either it would be expanded for, let's say, another month, or whether it would be open for everyone. We don't know that, but there has been some active conversation happening with the province as we speak, and I'm expecting that if not before the end of this week, but maybe early next week, we will have more clarity in terms of what is opening up, and we'll make it available for our community. We want to assure everyone that we will move forward as quickly as possible to ensure the protection of everyone. The moment we get the green light, the moment we get vaccines, we will open it up for other additional age group. Right now, the clinics are really booked and busy, but with more supplies coming in, we will open it up and expand the eligibility to give out the vaccine.
Okay, thank you.
Any additional questions from CTV?
Yes, just one more. Will there be further guidance on wearing masks once more people are fully vaccinated?
Well, I think we'll have to wait and see, especially when you are connecting with people in different setting, outdoor setting versus indoor setting, people who you know, or maybe people who are your friends or family versus people who are completely stranger, public space, private space. So there will be some consideration on all of these things, and I know even from in some other countries they have relaxed the requirement for masking for indoor gathering for fully vaccinated people. So I think that would be the first step, in my opinion. But we'll wait and see what the true transmission looks like and where the recommendations goes. But even before to get to that point, we would definitely want to have a very high vaccination coverage rate. I am personally looking forward up to a vaccination second dose vaccination coverage rate of 50%. That would be really great for our community, and then if we continue to increase further, even better. But right now we're at 25%, so I do feel comfortable, but we'd definitely like to see that number increase. So people, if you want to celebrate, if you want to go out, if you want to hang out with people, get your vaccine first and second dose quickly, so we as a community can move forward quickly.
Okay, thank you.
Any additional questions from CFTV?
Yes. Can you give us an update on the development/testing of a vaccine for under 12-year-olds?
I don't have an update on that, but I know that the second mRNA vaccine, Mrna, they have applied for authorization of use for 12 plus people. There are research that's been going on for 12 years and under, but I haven't seen any data even initial data that came out from that population. There may be some other logistical concerns in terms of the dosing of those vaccine for the younger people. Typically, for adults and younger people, they generally get half the dose. So that would be another thing that they need to consider when they're doing that vaccine trials in 12 years and younger. I haven't seen any data yet, but you know, if and when it's available, we'll definitely share it.
Thank you very much.
Any additional questions from CBC?
No questions, thank you.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
No, thank you.
Any additional questions from AM 800?
Sorry, Teresa, I know this has been a long one, just 2 quick questions. I know Amherstburg announced that the Libro Center vaccination site is closing in late August. I'm guessing Nature Fresh in Leamington will close probably in the summer as well. Is there talks ongoing about opening up a vaccination site somewhere in the county once these facilities in the county close down?
We believe with the provincial inclusion of more pharmacies and primary care providers that the plan moving forward would be for those channels to pick up people that require new doses and complete second doses. So there is and there will continue to be accessibility through those channels. I don't anticipate another mass vaccination site once the actual closing of those of Libro and Nature Fresh. I don't see that just because of the increased access through the pharmacies and the primary care.
And one final one for you, Teresa, as well. We got an email from a listener just in regards to the vaccine rollout. This family has individuals that are high risk. They got their first dose 8 weeks ago. As it stands right now, are they eligible to get the second dose or not because they are high risk?
Well, I'm not sure what their high risk definition is, but I would say that they're not eligible unless they meet one of the age criteria or that date of April 18th. So if they are deemed, and there is a very small proportion of the population that are in a very high risk medical group, and they all likely have received their vaccination. So if someone believes that they're in that group, they should contact their primary care provider. But right now, just based on that limited information, but they can call our call center and ask that specifically, and also speak to their primary care provider so they get the right direction.
Thanks, Teresa. Have a good day.
Any additional questions from Radio Canada?
No, thank you.
Thank you, everyone. We'll see you on Friday.